Public health experts around the globe are scrambling to understand, track, and to contain a new virus that appeared in Wuhan, China at the beginning of December 2019. The World Health Organization named the disease caused by virus COVID-19, which references the type of virus and year it emerged. The WHO declared that the virus is pandemic. You can see where and how many cases of illness have been reported in this map. The majority of illnesses were initially in China, where the virus first emerged, but the rate of new cases there has nearly stopped. There are now many times more cases outside of China than there were inside of it at the height of the outbreak. There are large outbreaks of diseases in multiple places including Spain, Italy, and the US. At the end of December, public health officials from China informed WHO that they had a problem. An unknown new virus was causing pneumonia-like illness in the city of Wuhan. They quickly determined that it was a coronavirus and that it was rapidly spreading through and outside of Wuhan. Coronaviruses are common in animals of all kinds and they sometimes can evolve into forms that can infect humans. Scientists think this new virus first became capable of jumping to humans at the beginning of December. It originally seemed like the virus infected people at a seafood market in Wuhan and spread from there. But one analysis of early cases of illness published January 24th found that the first patient to get sick did not have any contact with the market. Experts are trying to trace the outbreak back to its source. The type of animal the virus originated from is not clear, although one analysis found that the genetic sequence of new virus is 96% identical to one coronavirus found in bats. The virus is now spreading in dozens of countries around the world. Although it originated in China, the country took aggressive action at the start of the outbreak, shutting down transportation in some cities and suspending public gatherings. Now, the WHO says the epicenter of pandemic is in Europe, which now has more new cases reported each day than China did at the height of its outbreak. In the US, though, the outbreak is accelerating faster than anywhere else in the world. New York City has the highest number of cases in the country. US is seeing a similar trend to China as the coronavirus pandemic spreads rapidly across the world. If a similar trend plays out as China played, the US could see a slowdown of cases in the next 2 to 3 months. The virus is moving rapidly around the world. The new coronavirus spread quickly in contained environment like on the cruise ship the Diamond Princess. Early evidence suggested that, like other coronaviruses, the virus jumps between people who are in very close contact with each other. It also probably spread when an infected person sneezes or coughs. Coughs and sneezes produce little droplets of mucus and saliva. If these droplets make it to another person's eyes, mouth, or nose, they can get sick. The new coronavirus doesn't appear to spread through the air, but the early research shows that the virus can linger on surfaces such as plastic and stainless steel for a few days, which is why it's important to clean countertops, doorknobs, and other places people touch regularly. This virus has killed more than 32,000 people and infected more than 686,000 worldwide. So there are some measures you would take and should be taking to protect yourself against the flu. Wash your hands, cover your mouth when you cough, and stay away from the people who are ill. Stay home from work or school if you're feeling sick, and if you can, stay home even if you're not feeling sick. If you're older or have a chronic health condition which makes you more likely to have a severe case of the disease, you might want to stay away from crowded places and postpone any unnecessary travel. If you are a young, healthy person, you might not feel very sick if you catch COVID-19, but if you don't stay home and away from others, you could pass it on to someone who might get really sick. That's why it's so important to stay home. One of the best ways to slow the spread of an outbreak is by staying away from other people, which is also called social distancing. This gives a virus less opportunity to jump from person to person. It's why there aren't going to be big events, professional sports, and in some places schools for a while. Those measures help blunt the impact of an outbreak by slowing the virus. If fewer people get sick at once, it's easier for healthcare providers to give everyone good care. So this was everything to know about COVID-19. Stay inside and be safe. Follow precautions so you won't catch it or pass it on. Give us a thumbs up if you like spending some time here. Make sure to subscribe so you never miss an update. These are some hand-picked videos you might enjoy. Goodbye, see you in the next video.